Prevention. We're discussing a lot about prevention these 4 days. So, Gil, what is actually prevention?
Prevention is a way of treating something by not letting it happen or not letting it happen again. It's a good definition, but we need to ask ourselves, what do we need to do in order to promote prevention in the different parts of the world, in the different countries, and in the different cultures?
Well, the solutions we can implement in the first world are certainly different than the ones we can implement in the third world. So we have this main problem with the wealthy people that lead an unhealthy life, which leads to having a lot of diseases like cardiovascular diseases or even cancer. And then on the other hand, we have these people in the poorer countries that actually lack the knowledge on how to improve their life. And so they suffer from infections like malaria or HIV. So the question here is, how do we make first world people like you in the back row live healthy?
Well, the answer is, we give prevention value. How do we do this? We came up with a genius idea, very innovative. It's called the credit point system. Well, some of you might laugh and think, oh no, credit points again. No, it's not about university or college. No, it's not the same thing. But it has some similarities. So for instance, when you go to college, you get credit points for attending classes and taking courses, whatever. And in our system, you get credit points for living healthy, being active, eat healthy foods, for instance. And so now you think, cool, I have credit points. How can I use them? I can't eat them or anything. So we thought we have to give them value, right? So the idea is that you can use those credit points to lower your health insurance rate. So you can actually save money. Sounds great. But not all of the money you save you can keep in your pockets. I mean, it would be a cool idea, but it's not like that. You can save only the green part. That's why it's green. What about the blue part, you think now? Well, we're global thinkers here, right? So we thought, how could we promote prevention in the third world? I mean, they have problems too, different problems than we have. And there's always the question, is there money? Where we need money, they always need a way to finance all those projects. And here's the solution. The blue part, so about half of the money you saved goes to a fund. This fund is organized by the federal government, so we guarantee a little bit of stability and stuff like that. And it finances projects in the third world that promote prevention. So they pay for education and stuff like that, so they have the prevention too, but they have different problems than we have. So we talked a little bit about the organization. So how should we organize this stuff? We thought it would be best if it would be an organization under the roof of the federal government. So most of you think, no, not more government and stuff like that, but it just guarantees some stability in the system. And we need to define what is healthy. I mean, what do you get credit points for? I mean, healthy is a really broad word. And that's why we thought we need some expert group with specialists, nutrition experts, even people from health insurance, so we have some private sector in there, so it's attractive for the free market. And they would define what healthy is. So they say, for instance, you eat 5 pounds of apples a week, and so you get 2 credit points, and so on. It's not that easy, by the way. We have to calculate and everything. That's the main idea. So on the right side, you can see the concept. How would we introduce this project? For instance, here in Switzerland, it's very complicated with government and then insurance and everything. So we just put down 4 points how that would work. So again, what are the benefits of this system? 1, we would live healthier. It's great, so we can lower costs. It's attractive for everybody. Number 2, stimulates economy, especially local economy. If you buy more apples from your farmer, he'll be happy. And number 3, last but not least, we have now a way to finance projects regarding prevention in the third world. But Svetanka, do we already have some projects there, or?
Well, of course we have. I mean, that's why we're here, right? We want to transfer knowledge, underline transfer knowledge. We have here our magnificent ASAP project. It's a program that would promote prevention by completing certain goals concerning health throughout the world. So everything starts with this annual seminar that will gather young people from every corner of the world that would discuss 12 topics for the following year with high-profile personalities. Then these young leaders, young organizers, go back to their homes and organize their community so that they would accomplish these given goals. Every topic for 1 month, such as hygiene, vaccination, family planning. So within every topic, you have 4 weeks of completing goals. 1 goal per week, such as vaccinating 1,000 children from 1 poor village. So every end of a week, there will be reports written and uploaded on internet blogs. And by the end of every month, we have these video conferences so that the people could share their results for the past month. This video conference not only will share and see the results, but you would have insight into see what the people from other areas doing the same thing like you did for the past month. So it gives you, in a way, information, and also it triggers your inner competitive force to do better than the others. This actually has an aim in the end. The area that does best, that presents the best results, gets to be the host of the next annual seminar, and it goes on and on. So you might ask yourself, why would this work? I mean, there are thousands of projects around the world to help to better the world. So why would this project be different from the rest, the already existing ones? So first, and the very possibly important thing, are the expenses. So this is really financially less expensive project than the others, because everything you have to do financially is to organize that annual semester. The other connections between the people and the actions that were taken are held through internet connection, blogs, social networking, and video conferences, which nowadays are pretty cheap tools. Secondly, we have this ongoing process. Just picture a floating river. It goes on and just widens and spreads the idea. And third, we have this effectiveness. It is more effective because you accomplish goals minor goals for a shorter period of time that would seem meaningless or simple for this moment on a global level. But when you gather the raw results of a whole year, you can see that the change is actually happening.
So as you can see, sounds great, right? And so we hope that these 2 projects will greatly supplement our 2 key findings, or gold nuggets, we found during our workshop sessions, namely the transfer of knowledge in the developing world, and in the developed world, giving value to prevention. Thank you very much.
Thank you very much.